your apical as opposed to your apical coronal. Whereas in your ultrasonic, it is going to be transverse. Okay? Please begin second.
नीचे भी निकाला था हमने आधा बैग।
I'll show you one tool at different magnification, okay, and adjusting. क्योंकि ना आप लोग देखेंगे, you will be able to see what I am seeing in my eyes only, है ना? Nobody else can adjust it accordingly. So what I am seeing, you will be able to see. So let me just magnify and show you. Just take it out. Now, I was at 4. I am at 6 now. Let me just refine the view for you. Just a second. Okay, that the one I was working at was 4. And I'm just refining it. This is 6. Okay, 6 is clear. I'm going higher now.
Yes, ma'am.
I am at 10 now. Let me just refine it a little bit more. Here. This is 10.
Yes, ma'am.
Okay. Now, one thing I want you to appreciate whenever we do scaling, you, me, anybody, when we are doing it with our normal eyes, so we are not, conscious of this. So what is important is when you are working with a my naked eye, we are doing it without appreciating the harm that you're causing. Can you see that small nick over here where my tweezer is pointing? This area?
Yes,
A small nick, okay? So that is the power of magnification. At 4x I couldn't see it, but if I were to go more higher, so then that is where I can see. So when we are doing it in our normal everyday practice, this is something we don't appreciate. And Jaiva is very something that you have to take care while manipulating it, because the gentle you are, the better the results. So this is how it is. Let me just enlarge it more. So currently I was at 10x. I'm going to 25 now. Just a second, give me a second, I'll just refine it. 1 second. Now the thing in microscope is everybody's view is different and only you can change it according to your. Just a second. Up straight to not illegally go for it. Not focus on you. Just go illegally. Now it's better. Can you see? Let me just tell you, we are at 25x right now. Okay, and I'll get back to what we were working at. Just a second. We were at 4. So here, we were here. You see that? We were here and I just refined it. And we were thinking that everything is fine because I had to work on multiple teeth and see multiple portions. Let me just refine it here. Can you see the sharpness? Now this blurring and sharpness I am increasing or decreasing or getting the clarity with the, I showed you, the Nuvar 300 400. That is your working distance management. Okay? The refinement, the magnification change you're getting from the x's, the 10x, yeah, 4x, 6x, when you turn on that knob. But on the other side, whichever magnification you come to, you have to increase that refinement. You have to adjust the refinement. So that is what I had showed you in 300 and 400 millimeters. You got that? So how you get the refinement? And remember, when you are seeing through the eyepiece, it is only you who knows how comfortable or how much of light you need, how much of magnification you need, how much of refinement you need. So it is customized. It is for everybody. It is different. So what is seeming fine for me will not be fine for the next operator. Is that clear? Is that okay?
Yes, ma'am.
Oh, okay, good. So I can end the scaling demo over here, and I'm just looking forward that I could get a.
They will be seeing.
Yes, definitely. First hand they will be getting this. So now, first things first, when you talk about root planing, okay? So root planing is, so whenever you say what have you done SRP. So SRP obviously stands for scaling and root planing. So what is root planing exactly? What you're doing is now see, obviously you know this, I'm just stating the obvious. So this is your crown portion, this is your marginal gingiva, and what you have inside is your root surface. So whenever there is moderate periodontitis, mild to moderate periodontitis, what you're going to do is try to manage it non-surgically first. So any amount of surgery you do, if your non-surgical treatment is not good enough, then it does not succeed. So what you're going to do is root planing is planing the surface of the root. Okay. Now there is a shift in terminology. We do not call it root planing anymore. We call it root debridement, because root planing actually initially it was said that when do you consider good SRP? It is when there is glass-like surface on the root. But what happens if I'm going to give a glass-like surface on the root? If I'm going to make that root shine so much, debride it so much that it is shining and getting plain, what is one disadvantage of that? Can anyone tell me? I think Dr. Krishan, you can just convey to Dr. Krishan sir. If I'm over-instrumenting the root surface area, what's going to happen?
Cementum might be hampered.
Very good. Cementum will be removed, unintentionally removed. See, we actually have to remove the altered cementum. Altered cementum is the microbial infested cementum. But one disadvantage of removing cementum through over-instrumentation would be excellent. That is dentinal hypersensitivity. And then that is another headache to treat. So right now the current concept is you do not clean the root surface, but you just debride it. So what happens is whenever I am using the mercurate to instrument the root surface. Now when I don't know if you can hear that scraping sound of the root, but I think it is too low. So whenever you hear and you feel through your tactile motion, then that is root planing. But if I were to reverse and I were to work on the Gingiva. Then that would be called as anyone?
Curettage.
Excellent. That is curettage. So that's a basic difference between your curettage and your root plane. Okay. So in curettage, you're working on the gingival pocket epithelium. So the diseased epithelium you're going to remove. Whereas when you're working on the root surface, what you're going to do? See, this is the root surface. In fact, when you do it, no, you'll be able to hear that tactile through this tactile sensation. You'll be able to hear that sound and feel working on the root surface. So the same thing. If I were to reverse. आप ठीक है ना? So if I were to reverse and work on my pocket epithelium, then it's a shallow pocket. So then it's going to be my curettage. Okay. Again, what is the difference between your manual curettage and your laser curettage? So when you're doing laser curettage, it offers certain advantages because what happens is your laser curettage, what happens usually when you're doing the manual instrumentation, now you have removed the pocket epithelium, good, you have done your best. But it has been shown that the bacteria are present not only on the tooth surface or the outer pocket epithelium, but they are seated deep inside the connective tissue. So our manual, these curates are not going into the deeper parts of the connective tissue, right? We are limiting ourselves to the pocket epithelium. So that is where laser comes to advantage. I'll just show you the laser demo. Just give me 2 minutes, I'll ready it, and then I'll go to discuss how that is different from this. 2 minutes.
Yes, ma'am.
Laser. यहाँ बस ना लेजर से क्यों अटैच करेंगे जहाँ पे आपका रिलीज आ रही है. थोड़ा सा मोटा मोटा लग रहा है यहाँ पे. छोटा सा इंजेक्शन ले दो या ऐसे ही से ठीक है. ठीक. दे देना पॉज कर देना. Hello, ma'am.
Yes, ma'am. Yes, ma'am.
Okay. So now, what we had seen, root planing versus manual curettage versus laser. Did you see, were you able to appreciate some kind of fumes come out?
Yes, ma'am.
Okay. Those are what are called as laser fumes. Okay, that is called as laser fumes. So that you're going to study about tomorrow in laser safety. Why should you be masked? Why should you wear your I think you can't see me. Okay, you can just see the field of action. But actually, if you were to see here both myself, my PG, Dr. Anushka, and my patient, all three of us are wearing biohazardous, we are wearing the laser safety glasses. Okay. I think you are also going to have today afternoon when half of you are doing the exercise exercise on the microscope, half of you will be doing demo on the patient. Alright? So you will also be wearing these glasses, and it is very, very important that you wear it. And why should you wear it? What is the significance? Everything will be covered up in tomorrow's theory class. Okay? Yeah, so we were talking about, I was mentioning to you, okay, I think I'll just free the patient first because. So I was telling you how is manual and laser curettage different. So what happens in manual curettage, you are removing the pocket epithelium, but in laser curettage what is happening is, you know that laser is everything to do with laser tissue interaction. Okay, it has everything to do with laser tissue interaction. So there are these hemoglobin, there are these chromophores which are going to absorb this laser light and then going to give out its effects. So what it does is it penetrates deep inside and kills the microorganisms, which advantage we do not have in our manual scale. Okay, so that is the major advantage of our laser assisted curettage. Now one more thing I would like to stress, so what I did was with a normal diode laser, we focus on this one. Just a second, I'll just show you the laser we use. No, it's okay, this they will be seeing in the afternoon, just ये दिखा देते हैं. So this is your, just a second. So this is your diode laser, biolaser. You have already worked on this last time in your, I think on a tomato you have worked on it. So you're familiar, and any which ways you're going to come in the afternoon to see this. Okay, nothing to worry, you will be seeing this in the afternoon. But what I did right now was laser curettage. Give me 2 minutes, students, please excuse me, give me 2 minutes. I'll just be freeing the patient so that we can take up the next patient till I am taking the discussion. Okay. What I was mentioning was, so what I was mentioning was, we have seen two forms. I just did love because we are done with the patient.
Now we cannot see you.
Ma'am, I just want to discard my glasses. Give me 2 minutes. Because the patient is done, so I have a hand wash and discarding glasses. Alright. इसको ऑन कर सकते हैं इसको ऑन करना. अच्छा, am I visible now?
Yes, ma'am.
Okay, sorry. So what I was saying is, so we have seen manual curettage, we have seen laser assisted curettage. What we saw just now with the diode laser was laser assisted curettage. Now there is one more procedure which is called as LANAP. So LANAP is LANAP. So LANAP stands for laser assisted new attachment procedure. So how does that differ from laser assisted curettage? So that is basically done by a special kind of laser. So that is your NDI lasers. That is about 1064 nanometer wavelength. So this has about 910 wavelength. So that is 1064 wavelength. So that is called as a periolase. So that particular laser is called as a periolase. So what it basically does is, first the protocol to do a LANAP is, you obviously, like we did in this patient, just give a local anesthesia. Then you do the laser curettage as you saw here. Just do one round of laser curettage. Then what happens is, if this is your gingiva, this pocket epithelium is gone away. It is excised. So once the pocket epithelium is excised, you have access to deeper root surface. So again you repeat your SRP. Okay, you go deeper, repeat your SRP, and at the end again you are going to repeat the laser. Now laser is doing two things. So one, wherein it is getting absorbed, it is going and killing the microbes, and of course it is very specifically removing the diseased epithelium only, okay, leaving the healthy epithelium aside. So those melanophores and your hemoglobin is just attracting the laser light and getting destroyed. All the microbes are getting destroyed, leaving the healthy connective tissue over there. So what basically this does is, it encourages the epithelial repair and regeneration. So what happens is, not only the soft tissue component, but the hard tissue component, that is the alveolar bone, also benefits. So LANAP is a very good procedure, very good investment actually to go ahead if you want to go for your regeneration. But what happens is, this biolaser or a diode laser is much pocket friendly and it is versatile. You can use it in multiple ways. So that's why that is also preferred. And so I said ki first layer you have removed the pocket epithelium, then you have done your SRP, then again you have done a laser, one round of laser. So what it is doing is this side is removing, but this is getting absorbed. The laser light is getting absorbed. But certain laser light on the side of your tooth, what is happening is it is getting scattered. So even when it gets scattered, what it leads to is photobiomodulation. So again, all these concepts, all these terms that I am using today, you're going to get a deeper, clearer view tomorrow. So we have our 2 lectures lined up tomorrow specifically for lasers. So you will be seeing that. And as far as curettage, laser curettage or laser deepake goes, that you will be seeing today itself in the afternoon. Alright. So we are just awaiting a patient of deepake. I'll just confirm if the deepake patient is not here, then I'm going to proceed with what you are going to do in hands-on. So I'm sure you will be more interested in that, what you are going to do in hands-on. Let me just give you just few minutes. I'll just confirm if the patient is ready. If not, we'll proceed with the what you're going to do in the hands-on and give you the demo of that. Okay?
Yes, ma'am. Thank you.
ये नूरी है जो बोल रही है
अच्छा